2 hours past.
Hmm?
2 hours past.
2 hours? Oh, you mean 2 hours?
Yeah, I've been waiting for 2 hours.
But why'd you come so early?
Because I wanted to be number 1.
But you know that if you come early, it doesn't matter. If your appointment's at 9:45, you don't come at
No,
8:30.
9:15.
No, it's 9:45.
No, I checked it.
No, it's 9:45. On the 15th at 9:45.
See? 9:15.
Oh, wow.
See?
Oh, okay. 9:15.
Yeah, Buusan. Hungry. Hungry.
There's some candy.
Buusan, can you bring cocoa for me, please?
Cocoa.
Yeah, hot cocoa.
Oh, hot cocoa.
Yeah.
Let me go. Okay. I told you it was sugary. I told you.
So sweet.
Yeah.
Buusan,
What?
you want to share?
No, I don't want any. No, stop. No.
Now I can wait.
Yeah.
Buusan, せーの, wait.
So between the chemotherapy and the pill, from a hormone perspective, it's going to be most likely you will not have any hormone right now that's going to let you have a baby. In a lot of cases for young women, if they finish their chemotherapy and they don't have a period and they think they're done, sometimes within 6 months to a year it comes back. Okay? If it comes back, then you could get pregnant. When you're on the pill for cancer, that also will decrease your chance. While you're taking the pill, you most likely will not have any cycles because the pill will also block that. Okay? But it's not 100%. So it's possible that if you're taking the pill, that everything starts coming back and you may be able to have a baby on your own. We would not advise it while you're on the pill because we don't know what effect the pill would have on the baby. So while you're taking the pill, we would recommend that you avoid having a baby. Now, we don't recommend that you take birth control pills.
Yeah, that was it.
Because birth control pills have hormone. So it's the same hormone we're blocking. So that doesn't make sense to give you a pill for cancer to block the hormone and for you then to take something that's going to give you hormone. So while you're taking the pill for cancer, you cannot take birth control either as a pill or a patch or a shot. Any of those would not work.
Are there?
Okay.
That was the next question. Not to cut you out.
Yeah.
What you know what I mean? Like, what are the other
Sure.
options for
So-
non-hormonal birth control?
Sure.
'Cause,
You can do an IUD, okay, which is something that they can put in the uterus, and that will keep you from getting pregnant. You can get them with a little tiny bit of hormone, or you can get them without. So you could get that, and your gynecologist, this is the doctor that deals with this part, okay, they can put that in the office. Now, it doesn't protect against sexually transmitted diseases, just to be clear.
Yeah.
This is purely about that it will drop your chance of getting pregnant naturally to be about as close to zero as you get. It's not quite zero, but it's like 99% effective, okay, for pregnancy. So my suggestion would be that if you're concerned that you don't want that possibility, that even if somehow it manages to heal and you can be pregnant even on the pill, then you could do that, and that could solve that problem. And you don't feel it, you don't know it's there, and like I said, you put it in and you can take it out anytime. So that is the physical thing that you could do, and it can work very well.
Because he was saying like,
Some people use more temporary. If you don't want something inside, there are cups, there are vaginal cups, or diaphragms is the technical term. That's another option, but you have to put that in every time. If you are interested in potentially having children later, then that's something that we would have to think about for timing. Because as long as you're taking the hormone pill for cancer, again, most likely you will not be able to get pregnant. And we're talking at least 5 years. And it's possible that when you're all done, 5 years from now,
But Dr.
Yeah.
Chadam
possibly
said,
5 to 10 years. We're just,
right,
we're
I'm
just,
just saying
this
at
is-
least
this is-
5,
This is,
sometimes even 10 for some women, but at least 5. So if we're only talking 5, even if we're talking 5 years from now, when we stop the pill, and if you wanted to get pregnant at that time, it's possible you won't be able to, because we stopped everything on the hormone level, not the we're not talking about the IUD, we're talking about hormone. Between the chemotherapy and the pill, we have stopped your hormone for so long, it won't come back. So in 5 years, when you want to have a baby, you may not be able to. Okay? So for some young women, if they're thinking, maybe someday I would want to have a baby of your own, a biological baby, you need to think, do you want to do something now to try to save some eggs to maybe 5 years from now, if you wanted to have a baby and this did not come back, you at least have some eggs that we can then use to make a baby from. But you get the idea. There's 2 ways. We can either freeze your eggs, just yours, or we can, if you are committed and you want to have babies together, one option is we can make a baby in the petri dish and then freeze that. Those do a little bit better than the egg, but still, that's a whole different, I'm just saying, these are the options. Then if later you decide, yes, you want a baby with your DNA, then we just bring it out. So either egg or we bring the baby, whether you carry it or someone else, doesn't matter, but it'll be the baby, if it happens, it will be your DNA. If that doesn't matter to you, then the adoption means that if you want a baby anytime, and it didn't have to be your DNA, then there are lots of babies that need homes. So if you start taking the pill, the longer you wait, then the harder it's going to be to find eggs that are good. Because the longer we block the hormone, the harder it's going to be to make the eggs grow. Because we would have to stop the medicine and we would have to give you hormone, lots of it, to make the egg come up. The longer we wait, you're probably not going to get eggs that come up. That's why if you want to do it now,
for sure, right?
not for sure,
Yeah.
but like I said, it's your decision. If you want, we call it like a bank. You take it out, you put it somewhere, and it's insurance. If things don't happen naturally, you have that as a backup, if that matters. If you don't need that, and you go, well, if it doesn't happen, oh well, I either okay with no babies or I will adopt. You don't have to do that. Okay? It's an option. But you need to, at this point, we need to kind of see where you're at, because once you start the pill, we're going to block it. And the longer you take the pill, even if we stop and give you hormones to try to make the ovaries come up and make eggs, it may not work. So if you want to, you need to do it early, before you start. As long as it's not turning bright red, like your phone. If it's bright red like that, you need to tell him. So if you're getting bright red like, or even your shirt, just bright red and bleeding, you definitely want to show him.
like the skin starts turning this color.
That color, yeah.
Okay.
Then you need to have him look at it right away, because that could be an infection is getting underneath, and we don't want that on the implant. So he needs to see that. But the little bit of pink right at the edge, that's normal. That's okay. And if the scab starts falling off and you get a little bit of bleeding, it's okay. It's scary, but it's okay. Just push on it, hold it for 5 minutes, and then let it go. It should stop. If not, do it again. Usually if you do it a couple of times, it'll stop, okay? And then it'll just form another scab and, fall off, okay? But we'll just let that fall off, and then we'll see what it looks like. Okay, then we can decide if we need to do something or not. Okay, so 5 weeks is fine as long as it's just getting better day by day.
Time to go to bed.
Buusan,
What?
but I forgot that today Dr. Chu, what Dr. Chu said. I was thinking about what she said.
Oh,
You remember?
hold on. Yeah.
Buusan, where you go?
Oh, I'm looking for my notes.
Oh, okay.
Okay. Alright. Let me see. Oh, okay. Yeah, she said the bleeding that you had last night wasn't bad bleeding. It was just the good skin pushing the bad skin off, so it was dripping a little bit.
But it's 2 pieces of gauze. It was, I feel so many, but
But she
is
said
that
it was
okay?
good bleeding. It wasn't a lot. It's just a lot of drips on it and stuff.
Oh,
So yeah, it's okay. It's
Ah.
like the scab was coming off. The SCAB was coming off. Dead skin.
oh, and her part is almost gone. So she said, so after today, she needed to check up every 3 months.
Oh yeah, once every 3 months.
Yeah. Oh, but she again explained about the hormone pill. I think.
Oh yeah, just a little bit more explanation
Yeah.
of taking it.
Her explanation is better than Dr. Chedam, but
Yeah.
I can't say Dr. Chedam.
Yeah.
Yeah. So maybe 5 years, 5 to 10 years. This part is the same as last time.
You look like Bane from Batman. It's a bad guy character because you're covering your mouth.
Sorry.
Now you look like a pirate? No, you're looking for treasure? Can you see it? What are you looking at? Wait, let me see.
Yeah. So.
Oh, okay, wait. I found it. Yeah.
お花つける?
No, that's bad luck. No.
Yeah, so Dr. Chu said and the hormone pill, maybe not so much strong side effect.
Yeah.
And if I want to get kids, I can get even I get pill.
Yeah, they might,
After finish the pill, I will get a hormone shot
yeah, to help
or come back.
your period.
Oh, shit.
Yeah. Maybe.
It's okay.
Yeah. We'll see. But it was a good visit overall. You know, she said you're healing good and just waiting to see how the nipple finishes.
Okay. And my boobs has damp.
Oh, yeah, because the implant's getting settled.
What did you mean?
Settled, situated, getting in place.
Oh, so
It could take up to a year.
my implant is looking for place.
Your body's getting, it's trying to find, I don't know. I don't have implants, you do. I don't know what they're doing.
yeah,
Why are you asking me? I don't know. Do you guys know? Do you know? Do you know?
I go sleep.
Jeez. She asking me all these questions about implants. I don't have implants. I don't know. I don't know if they look for new places to live or whatnot. I know they're just trying to get comfortable. Like me. I want to get comfortable in bed. Go sleep. But what about everybody over in Japan?
Oh, I need to wake up. Okay.
I'll go get coffee.
So, Dr. Chu は言いました。私せyesterday, oh no. 昨日、私の胸から血が出たんですけども、それは良い血で、その良い部分が悪いかさぶたを押し出してるから出てもいい血だったみたいです。治ってる証拠だって言ってました。あとはドクター・チャダムは男性だからか、なんかドクター・チューはもっと詳しくホルモンピルについて話してくれました。なんかサイドエフェクトもそんなにないみたいで、子供もピルを飲み終わった後に注射でもう一回生理をよみがえらせて、埋めることができるそうです。そんな感じ？
There's no more coffee. What'd I miss?
Because it's night.
Oh, no coffee?
Yeah, coffee bar was closed.
Oh, shit. Okay, I go get juice. Do you want some?
Oh yeah, Buusan, the vegetable juice in the refrigerator, the tub was so hard. I can't open it.
Oh, okay, so do you want juice?
Yes.
Bye!
Wait! 会いたい。
きっときっと叶うからそばでぎゅっとずっと